Hello, everyone. I am Natalia Arcila. Welcome to the Empire Podcast. Today, I'm here with the amazing Dr. Suarez. Hey, Dr. Suarez.
Hi there.
Hey, so she is actually from Tampa, Florida, and she's been in business in aesthetics and anti-aging practice for 20 years. And guys, you are in for a treat. Dr. Suarez, can you tell me a little bit about your journey in aesthetics and anti-aging?
Well, first of all, 20 years sounds like so old, but I will say I love this field, and 20 years has gone so quickly. I actually started as a pediatric emergency room physician and somehow fell in love with this field. I actually went to an Empire training 20 years ago, which is kind of crazy, and that's how my journey began. Small world, right?
Yeah.
Full circle. And now here I am, 20 years later, loving the aesthetic medicine, loving anti-aging, loving wellness, and this is our journey for the rest of our lives.
Oh, I love that. Well, I mean, we do know that the aesthetics and anti-industry is booming. So tell me a little bit about the trends that you are seeing in your field today.
Well, I think the trends always originally have begun with like Botox and fillers, right? That's, I think, the bread and butter of every practice. But now we're seeing a big trend. We have a lot of young generations coming in now looking for more just anti-aging, preventative care for their skin, preventative care not to look aged. And so we have young people like you coming in and getting some lasers and getting some baby talks. And it really is a great trend that's going on. And then, we have the little bit of older people in my age, a little bit higher, and we love the wellness side, right? We now want to feel as good inside as we look on the outside. And so it's really gone, I think amazingly well in this field.
Yeah, very true. I definitely even need some Botox now. I've already gotten lip filler and I love it. So many do believe that aesthetics and anti-aging is just for specialists who can actually just perform this. Is this true?
Well, look, this is open to so many individuals, and I think it depends on which state you live in. But definitely for the state of Florida, you can actually be a physician assistant, a nurse practitioner, a DO, or an MD. And you can practice this, and you can practice everything from doing bioidentical hormones to weight loss, and then, of course, any injectable.
Oh, wow. Well, that's good to know because, there's always people who want to practice or want to get into it, and sometimes they can't. So thank you for that. What are some of the most lucrative or rewarding procedures that healthcare professionals should consider starting their practice?
Well, I think if they're just starting, obviously, I always say that neurotoxins are the gateway drug. Like everybody needs a little tox in their life, right? We all need to feel a little bit refreshed, looking a little better. And then I actually love dermal fillers. So I feel like that you can really help somebody with facial rebalancing and kind of just give that youthness, right? I'm all about that natural look, but always people think that doing fillers is not natural, but it really is. As we age, we lose so much volume. So adding a little bit back is just kind of trying to get back to where we were 10 or 15 years ago so that we can kind of feel good about ourselves. So definitely all of these trends are really easy to start in a practice.
Okay. And what, this is actually a question that I've had for a really long time. Just because, I am young and there's people at my age that want to get filler and want to get everything done. But what do you recommend for someone being young? Right? Like, where should we start if we want something, lips, cheeks, like our nose is filled? Because I know that's something that I really want.
Well, so that's a hard question. I really think that keeping it natural and setting realistic expectations. Look, we don't want young people overdoing it, but we understand that this is a society that we want to look good and feel better. And social media has really brought this up, right? So now everybody needs an amazing profile because we're looking in a camera all the time. We have our phone on. It's kind of crazy, right? The trends are kind of crazy. So you have to be careful looking at some weird trends online because that's not always the best thing. And so you want to go to a good provider that has that experience to really tell you. And I always tell people a little bit goes a long way. Sometimes a little bit of a tweak here and a little bit of tweak there, just making someone feel refreshed. Or if they had a little area that was asymmetrical and you're helping them balance that, that's okay, right? So you're just gonna kind of guide our younger population into keeping it natural and beautiful.
I completely agree with you, especially because, I don't want to be overfilled, but I definitely want a little bit of filler. So how does adding to aesthetic and anti-aging procedures to a practice benefit healthcare professionals in terms of patient care and revenue streams?
Well, as far as patient care, look, combination therapy is going to be the gateway for everyone. Like it's not a one and all. When someone comes in, they might do microneedling with PRP and they might do a tox. You also can offer them a laser and a filler, right? So we're trying to help both the volume, we're helping the skin laxity, and we're helping just making sure that the outside appearance of the skin is glowy and hydrated. And so I'm a true believer of skincare. I think when I was younger, I didn't really believe in skincare. We didn't have the fine lines and wrinkles then, like we didn't care. But as I've aged, I really understand the importance of that. And so if I can tell any young person to at least go on a good sunscreen, make sure we wash our face every night, take off your makeup, and get on a good anti-aging product, whether it's vitamin C, it really goes a long way just to start to do a little bit of prevention.
Well, thank you, because I know so many people really want to start with, just Botox and want to leave it there. But there are so many healthcare professionals that don't know what to get into, right? They just start with Botox and they're like, let me just do Botox forever. So you bringing up combination therapies is huge. So thank you for that. Now, tell me about some misconceptions healthcare providers have when transitioning into the aesthetics and anti-aging medicine.
There's two ways, right? They either think it's going to be really impossible and they're just never going to be able to do that. They think they're going to come in and it's just a side job. They want to do it because they don't want to pay for tox or their family all wants some tox and they don't really want it as a business or as a career. But look, as medical professionals, we really need to go all in, right? But I kind of did the same thing. I worked the ER for a few shifts and then I would show up to my practice for a few shifts. And then I realized, as you get passionate, you have to be the best that you want in anything you do. And that takes a lot of practice. That means going in day after day and being the best you can, constantly learning, constantly taking courses. That's what we do as medical professionals. We never stop learning, and we need to make sure we do that. So just to think that you're going to go in and do some tox and be this amazing injector, that's not how it works. Practice, practice, practice is always key.
Okay. Well, so where do you think the switch for you was? Like, when did you stop? When did you get out of the hospital and fully into aesthetics? What was that switch?
So I think it took me almost 5 years, maybe a little longer. And the reason for that, so it was a personal thing, right? I left the ER and I went to aesthetics. And so for me, it was like, well, what if I stopped learning how to save someone's life? When would it be the next time I could put a chest tube in? It was a really kind of daunting aspect. But I think my change was when I started making an impact in people's lives, right? Not necessarily saving someone's life, but saving them internally. They came in and I would get a big hug and say, wow, I feel amazing. To empower someone to feel better will change their lives. They go out into the field and they're better. And so being able to do that in this field is something that I would never give up again.
Wow. Okay. Well, I love to hear that because I'm on the other side of things, right? So you guys, you do my lips and I walk out and I'm like, ooh, I love them. They get a little swollen, but then I come back to you and say, hey, let's do it again. So, and that for me is every 6 months I'm there, or at least once a year. So you teach Empire Medical Training, which is known for our educational programs. What is it like teaching other healthcare professionals in such a fast evolving industry?
Wow. I do love it. Everyone knows at my company, this is my passion. Teaching has become my passion. Even at my practice now, we do probably 2 to 3 times a month, some kind of seminar and some kind of educational platform. So for me to be able to come on this bigger platform is really quite amazing. I will say, I love teaching them all. I love teaching advanced providers, but I also love teaching the new ones, right? There's nothing better than when you first give somebody a needle and they're so afraid. And then after about 10 minutes of injecting, they get this moment and this aha moment. And they're like, oh my God, this is it. Like they love it. And to see that is so exciting. It's like, that first date, that first kiss, it's that first tox. There's nothing like that.
Oh, I love that. Yeah, no, there's definitely nothing like the first Botox because 2 weeks later you see yourself and you're like, wow, I look good. What are the most common challenges you see healthcare professionals face when learning aesthetics and anti-aging procedures, and how do you help them overcome those things?
Well, I think the first one would probably be fear, right? Fear of hurting the patient, fear of not getting a good result. And again, that just takes education, understanding the concept. And so that's why it's so important to do these courses and really learn. And step by step, what you need to do. What are the steps as far as injecting? What do you need to look for? How do you prevent things? So I think that when you teach someone, if you can really arm them with all that education, that fear goes away. And that's really, really important. The other factor, I think, is people, again, think this is kind of a different kind of world, right? That the aesthetic is not for everyone. But it really is. We have every single kind of person that comes into our office, and both men and women. Everybody wants to feel and look better. And I think we need to own that, and we need to stop being so shy about hiding it and saying I can't have done. I think it's always funny to me at 50 when people say I have no wrinkles but I've never done anything. Like, okay, I will tell you everything I've had done, and that's okay. We need to own what we do because it's okay, and we learn from that. And that's a big thing, I think, that providers, to make our patients feel comfortable that it's okay.
How do you think Empire Medical Training approaches the hands-on training a little bit different than maybe other programs?
Well, first, not only do they have a hands-on, but they have an amazing lecture profile, right? So again, we're teaching them the basics. We're allowing them to get really comfortable with that basics. And then we're being able to take them into more advanced classes. And there's such an array of classes here. Like, I think that's what I love, is that, I mean, you can learn anything from sclero to threads to hair restoration. And then, of course, bioidentical hormones, which is one of my favorite things. So you really have this big array, and you're presented with all of that. And then they actually have a platform that you can go in, get consent forms. I didn't have any of that. I had to make all my own. I wish I had a program at that time that said, here's everything that you need, and go be great. So this is really important. And I think if patients, or I guess as students take these courses, that they take advantage of that and they really learn all the courses, because all of it will impact a patient. And so they really need to be well educated.
Wow, you're making me want to start in
Let's
aesthetics. So I'll let you know when you want to train me. But definitely, what is your favorite treatment to perform? And what makes it enjoyable and rewarding to you?
I love them all. I will say, though, still, I think fillers are still my favorite. I think it's just such an artistic field that you can really make someone look just amazing by adding a little bit of tweak here and a little bit there with fillers, and they feel and they leave feeling so confident that you were able to do that for them.
I love that, because I love filler. But again, like we spoke about, so many young people just feel like it's too much, or the older people are like, no, I'm never going to get that because I don't need filler.
Cute fact. Do you know that one filler is 1/5 of a teaspoon? So when they look at a syringe, people think, wow, you're going to put all that in my face. Where would it go? And then I laugh and I go, if I take these 5 syringes and I lay them out, that's just a teaspoon that I have to sprinkle all over your face so that it can look symmetrical and glowing. And then they're like, oh, that's all? Yes. And then we take it from there.
Wow. You are definitely an artist, getting all of that and making us look so beautiful. What are top 3 procedures that you believe everyone should learn, and why do you think they should learn them?
I only get 3, huh? Okay, so let me think. Well, of
you
course,
can tell me more.
Number 1 has to be your tox, right?
Okay.
It's your gateway drug. Everybody's going to come in and have a little bit of a glabella line, a little bit of a frown line. They all want to start that. So that's a gateway one, number 1. Number 2, you have to have a filler. Once you start in the Botox world, people are going to ask for the next part, right? How do I help my tear troughs? I look a little sunken. Everyone comes in and does, how do I get this? It's so cute. I even have started doing it now. Like, we all look in the mirror and we all want a little bit of this, right? And that's okay. And so that's going to be your fillers. And then I think another device that's going to build collagen. So whether you have a plasma device or a laser device, they really help. Again, we're about prevention, right? We have to help. We live in the state of Florida. We have a lot of hyperpigmentation. We need to help with melasma. So having a laser to kind of help with rejuvenation, treating acne, treating hyperpigmentation, treating skin laxity, that's all going to be important. So I think that would be my top 3 to start with in a practice.
Empire offers memberships to acquire CMEs and take multiple classes. What do you see as the key benefits to acquiring a membership?
Well, gosh, there's so many. So now they actually have virtual classes, which I think are amazing. So if you can't get out of your office, you can just sign on in and do the virtual classes. Then when you're ready, you can do in-house classes, which the most important is that you're going to have hands-on training. You have a portal, again, that we talked about a little bit, that you are going to be able to have your consents. You're going to have all the information, your treatment forms. And then they also have vendor partnerships, right? It's really important to understand your buying power and to be able to get in at a better price point. I personally love the business side of it. So I love business classes. I think that's amazing and it's part of the portal and a part of the lectures. And then the cadaver lab. When I trained, there was no such thing as cadaver labs. I think this has become a thing in the last 5 to 10 years. So now I try to go every single year and I take one of the classes because I learn and I am humbled every single time I take a cadaver class. And so if there was anything I could say, that is probably the most spectacular class that you can take.
Wow. When was the last time that you took one?
I just took one last month.
Wow. Okay. Well,
yeah, it was amazing.
Okay. Well, then everyone should still be getting into those cadaver classes. Tell me a little bit about the techniques and treatments in aesthetics and anti-aging that you believe are going to be the biggest in 5 to 10 years.
Well, definitely wellness. I think we're on a big trend understanding that bioidentical hormones is really what's helping people live healthier and longer lives. We see so many studies now that we're improving cardiovascular risk, we're improving cholesterol, we're improving hypertension. I am a big proponent of hormones. And it's hard. You'll get a lot of people that don't believe it and think that we're doing harm, but really the studies have proven that we're really helping people live longer and healthier lives. And what better thing is that than we are just not only making people beautiful, but feeling amazing inside. There's nothing better than to see a 70-year-old sitting there flexing, looking hot. I'm so proud. I want to be that person one day.
I want to be that person now. So let's, get all of those things done now. If the earlier we start, the better we're going to look when we get older.
For example, we as ladies have estrogen, testosterone, progesterone all of our lives. And then we go to perimenopause and then the amazing menopause life of ours. And so all of a sudden, we don't have hormones. And so think about it. So I always tell people, if I could sprinkle testosterone on everyone, we would have a happier world, okay? Because what does testosterone do? It increases memory, it increases focus, it increases libido, it increases your energy. There's nothing, and lean body mass, like we all want that. There was nothing about testosterone that we don't want. And so as we age, we'll start to have that. So we're a little bit more fatigued. We can't concentrate as well when we go through menopause. And that's just because we have lack of hormones. I think most women only consider menopause as hot flashes. And so hot flashes is terrible because you're sweating all night in your bed and you're sitting there. I've had it where I'm injecting a patient. I take the chiller and I'm like, hold on, I need it for me for a moment. And I have a little breakdown and then I hand it back to them. But that's low estrogen, right, that we can treat. Wow. And then progesterone, look, women can't sleep. They go through depression. They go through anxiety as we age. And that normally just needs a little bit of progesterone to kind of rebalance us. So we go from being really well balanced as a young adult, then we go through menopause without being balanced. So giving that back really helps them feel like we're 35 again.
I honestly didn't know as much as what you just told me, especially being able to get older and not have to feel as though I'm just aging and things are just going to go downhill, but I can really have a better life as I continue to grow. So for those starting out in aesthetics, what would you say is the first procedure that they should master?
So definitely Botox, right? Or any neurotoxin, because that's what people are going to just call, they're going to Google you, right? It's the number one thing. I think the stats was something like 7 million people get Botox every single year. Like those are astronomical numbers. Wow. And then it's 3 to 4 million get filler. So you already know that that's probably the number one call you're going to get is, how much for your Botox can I come in? So you got to start there.
So many people are so interested in Botox, but they never know like where to go. So now that you bring up, Googling, what do you think is the importance of becoming board certified and like people looking you up?
Well, board certification always is great, right? We want to show education. So I always believe in two things. I believe in culture and experience, right? And it's kind of hard in the beginning. You can say, well, what if you just started, you don't have experience? But your experience is your education. The amount of time you took to learn, the amount of practice you invest into your patients, right? This is all what your patients want to see that you're doing that. And then culture. Like for me, my practice, it's about everyone believing in the same thing to make sure that we're patient forward. The patients come first. We need to make sure that they understand and that you educate them. And that really goes a long way and they'll build that trust with you.
How has your experience working with Empire Medical Training influenced your own practice and your approach to patient care?
Well, I feel like we learn every day. Look, even giving a class and teaching a class, I feel like I learn. It's those little subtle things that you might have forgotten. Sometimes we're injecting so long that we get into our own little habits, right? And sometimes we have to break it. I have this little thing like I have to snap out of it and try something different and make sure that I am doing a very comprehensive assessment. Sometimes that's hard when your patient has been your patient for 15 years, right? We get into this like catch up on our life stories, right? This is the gossip world. This is therapy.
You become the therapist.
I am the therapist. And so sometimes we have to stop that. And I see that now when I have to systematically teach new people, you have to go through A to Z to make sure you're not missing anything. And so it just kind of reconfirms that in my own practice that even though I feel like we have this bond now and I love you, but I need to make sure I'm doing everything I need to do for you and not forget anything during our journey.
You guys are consistently learning different things, even in the class. And I think that's really cool because you guys are consistently growing, as so are our attendees. Dr. Suarez, many of our listeners are considering going into aesthetics and anti-aging medicine. What advice would you give them to get started successfully?
I think you just got to take the plunge and dive in. Like, there, we have this fear of something new, but this is an amazing field. And I think once they go and commit to doing this, they're not going to turn back. They're going to be so excited about this field. It's going to lead to another thing and another thing like I did. You start with one thing and next thing you know, it's 20 years later and you've built a large practice. So they just need to dive in and not be afraid.
Wow. Well, it's so great that you say that because I love to see the success stories that come out of here. I am with them consistently and they just tell me like Empire has changed their lives. Attending classes has really opened them into a new world. So definitely dive in. Now, if someone listening is nervous about that steep learning curve, what would you say to reassure them about the training and the support that they have available?
Listen, we went to school for 12 years, right? We are in a practice and a medical practice, all the medical providers. You go to school so long, you really learn everything. This is just another stepping stone. I mean, we've learned how to do everything else, whether you're a primary care and you're learning how to treat somebody's hypertension or cholesterol, whether you're an ER doc and we're putting in chest tubes, whatever it is systematic. We learn what's the proper way of doing a procedure, what are the risks, how do we treat that, how do we benefit the patient. It really is just another small stepping stone, and there's really no fear. It's just another fun procedure to learn.
Wow. Yeah, you guys definitely learn a lot, especially getting into the aesthetics world. I mean, I think it's so exciting. She's making me want to become a doctor. I'm going to go back to school. And finally, what's one message that you would give all of the medical professionals listening in this conversation about the opportunities in aesthetics and anti-aging medicine?
Don't be afraid. This is an amazing platform to be able to empower people to feel and look their very best. So let's go and join me.
Definitely. I mean, no fear. I think that is the biggest thing that does hold us back is fear. Like, get into it, dive in because the opportunities are endless. Well, Dr. Suarez, thank you for coming around. We definitely love hearing from you, learning from you, and seeing you around here.
Oh, thank you for having me.
Thank you for joining us. I'm your host, Natalia Arcila. Please leave your comments down below. Any questions that you have, we'd love to answer them. Like, comment, subscribe to the Empire Podcast.